Okay, this chapter talks about immunity and abnormal responses. Before I get started, I just want to bring your attention to the beginning of a lot of the chapters in this book give review sections for topics we probably covered in A&P, but I want to remind you that a lot of this information is very important, and I may pull this into test questions um, in this course. So, just things like functions of white blood cells, vaccines, primary versus secondary immune responses, lymphocytes, what their functions are. Just make sure you read over that beginning material. Okay, so this chapter starts off talking about tissues and organ transplant and types of tissues that can be transplanted. Allograft is from one person to another, but not being genetically the same. Isograft, these are individuals that are genetically the same, identical twins. Autograft, from one part of the body of an individual to another part, but it's the same individual, like autologous donation, donating a unit of blood for yourself for upcoming surgery, or transplanted tissue for burns, blood vessels for bypasses in cardiac surgery. Those types of things are considered autografts. Xenograft is from one species to another. So those are just definitions. Types of rejection. Hyperacute rejection of tissue occurs immediately after transplantation when the circulation to the site is reestablished. Usually from antibodies from a previous blood transfusion, blood vessels are affected, and you have decreased blood flow to the transplanted tissue. So these are from existing antibodies. Acute rejection usually occurs after several weeks when unmatched antigens cause a reaction. Chronic or late rejection occurs months or years later with gradual degeneration of blood vessels, many years later sometimes. Now, immunosuppressive drugs that are important in preventing your immune system from attacking transplanted tissue. Cyclosporin is a fungal type of substance that will block the creation of new immune responses, but will not interfere with anything that you have that's previous memories. So your immune system that's in place is kept in place, and it just blocks you from forming any new types of reactions to things. And this is primarily used when you have an organ transplant, kidney, heart, liver transplant. These other things are used in other types of transplants, and then prednisone, of course, is used for an anti-inflammatory agent because when you do have transplanted tissue, that's going to initiate the inflammatory response, and prednisone is a major anti-inflammatory type of medication. Now we go to types of hypersensitivities, and there are four types 1, 2, 3, and 4. And type 1 allergic reactions, these are involving an antibody that's called IgE. And what you see here is walking you through what happens with a type 1 infection. The allergen comes in, the immune response makes IgE, and remember this comes from B lymphocytes. And the IgE will attach itself to mast cells and basophils that produce histamine. And the sensitized mast cells and basophils are in place now, so that the second time that you are infected by that particular allergen, that causes the release of histamines, and the histamines cause the inflammation. So inflammation results in vasodilation, increased permeability of blood vessels, and that results in edema, redness, and pruritus, which is itchiness. Type 1 sensitivities can also result in something called anaphylaxis if it is a very severe type of situation where you get a lot of histamine produced. So what happens is sensitization occurs like in the first response, and then your second response, here comes the allergen, and it binds with the IgE antibodies, and the mast cells are going to release large amounts of histamine into the general circulation, and this can result in a massive outpouring of fluid from your capillaries, which can result in excuse me, this can result in systemic shock. The skin, nerve endings are affected, which can result in itchiness. It can also cause bronchoconstriction and release of large amounts of mucus. But what could happen is airways could be obstructed, difficulty breathing, and if this is severe enough, rapid loss of blood pressure, constriction of the airways, can result in severe oxygen deficiency to the brain, and the person could actually die. So these are very, very serious type of reactions. And most people that have this type of problem usually know that they have it and what they're allergic to, and so they might carry a card that says what the causative agent is for their particular type of allergic response. And remember that the most common cause, penicillin. Penicillin is very common, but we're seeing a lot of other things rise now to the top, like shellfish and peanuts, and there are a lot of really common substances now that are causing people very serious allergic reactions. So, anaphylaxis, signs and treatment. With the skin, itching, hives, or tingling, respiration, difficulty breathing, that's dyspnea, wheezing, cough, tightness in the chest, cardiovascular types of problems, decreased blood pressure with rapid weak pulse, that's from the outpouring of fluid from the circulatory system, central nervous system, anxiety, fear, weakness, dizziness, all these things could lead to loss of consciousness later. So, treatment, epinephrine, EpiPen, as soon as possible to minimize the effects of the reaction. Antihistamine drugs, Benadryl, chlorotrimidine, glucocorticoids reduce the inflammatory response. So those are treatments for anaphylaxis. Now, type 2 hypersensitivities. This is called the cytotoxic reaction. And usually this involves ABO blood transfusion incompatibilities. And the chemical substances involved, type 1 was IgE. This could be IgG or IgM, and this also draws in complement. So here you have anti-A antibodies in type B blood mixed together, and this is going to cause, this is your reaction, antibody-antigen complex, and then that draws in complement. This causes the lysis of the cell wall, the red blood cell, and then phagocytosis is involved, but this is the process of the transfusion reaction. And so that one, transfusion reaction is the major cause. Type 3 is generally autoimmune. And so what happens here is that you wind up with antibodies that bind to the antigen in the bloodstream. These immune complexes form in the circulation. Here you see IgM and you see IgG complexes. These will deposit in blood vessels or tissues. That's going to activate complement, because remember, IgE and IgM activate complement. And so these deposit in tissues, and the activation of complement causes an inflammation response at the site of the deposit. And then that inflammatory response causes the release of lysosomal enzymes and chemical mediators from the tissues that are infected, and this results in tissue damage. So this is the process that autoimmune diseases, this is what you see, that causes the injury to the tissue in autoimmune diseases. And it can cause inflammation, vasculitis. So this is type 3 immune complex reaction. So lupus, Graves' disease, these type of diseases will result in this type of reaction. Now, type 4 is a cell-mediated delayed type of hypersensitivity, and this is where you get antigens binding to T lymphocytes, and the sensitized lymphocytes release lymphokines, and this is what causes your problem. So here, the macrophage presents the antigen to the T lymphocyte. Then the T lymphocyte becomes sensitized and it starts to release lymphokines, and this causes inflammation and lysis of antigen-bearing cells of the tissue, and the tissue becomes destroyed. Transplant rejection is the major, this is the major problem which causes transplant rejection, because it is foreign tissue, and this is the mechanism by which the T lymphocytes are activated to destroy that transplanted tissue. That's type 4. Now, the autoimmune response is the response where you see, I'll show you, I'll walk you through the normal response first, and then we'll talk about the abnormal response. But the normal immune response, the invader comes in, antibodies are produced, that's your first exposure. Then your second exposure, the antibodies are there, so they take care of the invading antigens, and then they stay there to protect you for the future. So the production of antibodies, blocking anything that comes in, and remaining there as memory agents for future infections. Now, the autoimmune response, the immune system forms antibodies to self-antigens, and that's not normal because you don't want things that are anti-self. Now, those auto or self-antibodies attack self-antigens and immune complexes deposit. These are what deposits in tissues. This is your type 3 reaction we just went through, and inflammation and tissue damage occurs. So that's the autoimmune response. Now we'll talk a little bit about lupus, because lupus is an autoimmune disease, and this disease infects primarily women between the ages of 20 and 40 years of age. The name comes from a facial rash, which is erythromatis, and lupus means wolf, and it occurs across the nose and cheeks, and this resembles the markings of a wolf. So autoantibodies are produced that are anti-DNA. And these anti-DNA or anti-nuclear antibodies are what they test for when they're looking for lupus. These are the markers, and they're called ANAs. So common manifestation, the polyarthritis, so arthritis, pain all over the body, butterfly rash, hair loss, glomerulonephritis, pleurisy, carditis, Raynaud's syndrome, psychosis, depression, seizures, anemia, leukopenia, thrombocytopenia, a lot of different symptoms that people can have, and the manifestations vary from person to person and how the severity of the case. So ANAs, ESR to check for the presence of inflammation in the plasma, and the treatment primarily is prednisone to minimize inflammation. This is looking at the butterfly rash you see here on the left. And on the right, this is what you call an LE cell. This is a neutrophil that has taken in a cell that is a lymphocyte material that has been caused by the destruction of cells by the lupus process. So this is called an LE cell. So now we're going to move on to HIV and AIDS, and when we talk about immunodeficiencies as a whole, these are caused by a loss of function of one or more components of the immune system, and it can make the individual susceptible to infection or cancer. Replacement therapy for antibodies using gamma globulins. In severe cases, bone marrow or thymus transplants are possible, but success is limited. So acquired immunodeficiency syndrome, or AIDS, first case recognized in 1981, and now is a worldwide problem. HIV, human immunodeficiency virus, is the causative agent, and HIV attacks CD4 cells. And this is the process of infection, and also talks about a couple of treatments or ways to block HIV. Normally, they find that a cocktail is more effective in treating HIV because it will target the assembly and the creation of new DNA and creation of new capsules in the assembly process of the virus. And that's what they try to do, is hit it from many different directions. But initially, the HIV particle attaches to a receptor on the CD4 cell, and then the viral RNA and reverse transcriptase enzyme enter the CD4 cell, and then the enzyme converts the viral RNA to DNA. And here's one means of blocking this: is the drug AZT blocks transcription at this point. But the viral DNA joins helper T cell DNA and causes that T cell to create more viruses. And when that T cell becomes filled up with the viruses, then it releases them. And here's another way of blocking the process is anti-HIV protease inhibitor drugs block this at this point. And then when these viral particles are assembled and they're released, the infector T cell sheds many HIV particles to invade other T helper cells and lymphoid tissue, and the infected helper T cells are destroyed. There's 3 phases. The initial infection, usually 3 to 6 weeks with mild non-systemic flu-like symptoms. It usually is self-limiting. Usually the immune response limits the infection, and antibodies form in 2 to 10 weeks. And you can test HIV positive initially. In the second phase, or the latent phase, which may last years, you're asymptomatic. Lymphadenopathy may be present. T helper cells counts decrease, and weaker immune response gradually moves into active infection over time, but this varies again from person to person, and it could take years. The acute infections, this is the actual immunodeficiency, or AIDS. You have a very low CD4 count. Multiple severe opportunistic infections occur. These are infections that normally wouldn't happen in the average person. They're usually fungal in nature, but they do happen in AIDS because of the suppressed immune response. Cancers occur more often, wasting syndrome, eventually nervous system involvement, and the person dies. So that's the course of the disease. How is it transmitted? Body fluids, blood, semen, vaginal secretion, diagnostic tests, blood tests for HIV, antibodies and decreased number of CD4 cells, opportunistic infections like pneumocystic cardiae, this is a pneumonia, and Kaposi sarcoma. Also TB is another thing that you'll see occurring more often in people that have AIDS. And treatment, AZT, there's different types of preparations, and you can look into these. Sequinavir inhibits the HIV protease, and ritonavir, I'm not sure if I'm saying that right, Ritavir, I'm not sure, blocks viral assembly. So those are